So our next speaker is going to tell us more about just the transformation of behavioral health at BCH over the years. I am so happy to introduce Jackie Attlesey-Pries, I know I said that wrong, I'm sorry, who is our Vice President of Operations and our Chief Nursing Officer. And I'm just gonna pull up her presentation. I think this is, yep. Oh, okay, great. Thanks so much, Jackie.
Thank you, Amanda. Well, good morning. I do realize I'm the only thing standing between you and lunch, so I won't dwell long on a lot of this work. But it is really important for you all to understand where we're at BCH and how important it is to have our partners here today, because it is a key piece of what we are trying to achieve in our community. And it's part of our vision, as you've heard, is partnering. All right, let's just see. I can't find the, there we go. Oh, sorry. Did someone say something? Oh, no. Okay. Oh, thank you. So, in about 2021, so as you all know what was happening at that time, we were coming out of a pandemic. Certainly this community was dealing with the isolation, certainly a lot more mental health issues for all of us. And we started out on a new strategic plan with our board. And in that, again, you can see building on our vision, which was created a few years prior, and our mission, we identified 4 big goals to try to get to our big aims of financial sustainability as well as the highest quality care. And I'm going to focus in on one of those, which is the service line piece of these goals and transforming some service lines. So we probably, depending on how you define a service line, we probably have between 12 and 14, sometimes you could count a couple other ones, 15, 16 service lines at BCH. And as we were looking at how we achieve our goals and how we create that vision, how do we create the healthiest community in this country, we needed to focus some energy around growth, around expanding services, around access. And so what we really looked at was a service line structure, because that is a way in which you can work. I'll use the example of behavioral health. Behavioral health had good work going on at this point. It had for years. We had a lot of really great success stories, wonderful patient stories, staff working really hard to take care of the community in this way, and we were making incremental changes. And so the transformation piece was really to focus in on a couple of service lines to really transform them, to integrate them, to assure that we were meeting the needs of this community. And you can see the reasons why you pick it in a service line. It is easier to understand and to look at it from the whole. And as I get into our SWOT analysis around this, you'll see what was missing when we were doing the incremental changes and adding services versus a transformational look. So we embarked on assessment to look at those 12 to 16 different types of service lines that we had, and what were we going to choose to transform initially. And one of 2 that we chose initially was behavioral health. I'm going to repeat that. One of the 2 out of that 16 that we chose to transform was behavioral health. The other one was one of the sexy, it was cardiology, the sexy, one that had a lot of growth looking at it. And I would think many people looking at that point where our organization was at would say, that doesn't sound like a strategy. That doesn't sound like that is something that you all should be doing. And again, we are one of the few organizations in this county that still, well, we're the only one that still has an inpatient behavioral health unit attached with the hospital. And it has been an important part of our focus. And it obviously is a very hard service line to remain financially stable on, even to the break-even point for us. And so that was a really remarkable decision by our organization, supported very heavily by our board of directors and very heavily by our foundation as well. And I'm going to talk a little bit about where that all comes in. But it was an easy sell. So when I went forward and said, here are the two I'm recommending, nobody pushed back. Asked a few questions about why behavioral health and what we hope to achieve. And again, huge support because of the importance of behavioral health for what we're all about, is trying to create the healthiest community. You cannot have a healthy community without healthy individuals. And you cannot have a healthy individual unless it includes not only the body, but the mind and the spirit as well. So this was where we started. After we made the decision to look at behavioral health in a transformational way, we did an assessment of where were we at. And I'm going to start just focusing on a couple of things. So first, the strengths. So again, as I talked about, this is not easy work, and we had great staff, very dedicated staff. This is everything from our providers, to our nursing staff, to our therapy staff, to the front desk staff, to everybody, all of our techs who work in the behavioral health space. They were dedicated. They wanted to make a difference, and that came out very strong in our SWOT analysis. The other thing you're going to notice on there is we had a beautiful new building. We had outstanding community support that started at this stage in 2017, where our foundation focused on behavioral health and created the mental health endowment. Grant Bresser led that activities and really helped this community come together around behavioral health, around mental health, and started what I believe is continuing today, which is really to destigmatize the conversations around mental health and really allowing people to get the help they need in this area. Again, we had strong support by our organization as well and the community, and we were one of the few organizations across the country who had started several years before with our behavioral health specialists in primary care. That is huge, and that is a really important part of transforming this service line. You can see where our weaknesses were. So this is what you'll see as you look at the projects that we undertook. They are really around trying to look at these weaknesses and some of our opportunities and threats and really trying to build on those strengths that we had. So one of the biggest things is we were not integrated. I think Grant asked me that question about the preceding years, maybe once a month. Like, it doesn't feel integrated. It doesn't, when are we going to get everybody together? Again, we had really great programs, really great people working, taking care of the community, but it wasn't really integrated. We were working in silos much more. I call it no right door. You're going to see what our vision was, but we had access issues. So there were a lot of people waiting for the care of our clinicians. And so that was a real problem that we had to fix. And there did seem to be no right door. You couldn't quite figure out how you could access the services in a timely manner when you're talking about this type of care. One of our other real threats that I'm going to focus on, we talked about it a little bit earlier today, is getting reimbursed, getting paid for this care. For example, at the time we looked at this assessment and this threats, that prior year, so this was 2021, almost 25% of our accounts on our inpatient behavioral health unit had zero reimbursement. So that's a lot with zero, and a few more percentage that had less than $100 on their reimbursement side. That's for a variety of reasons that we have dug into over the last 2 years and continue to be challenged with. So that's where we were at, and so what we decided we needed, it was a vision. And so this is the summary of our vision for our behavioral health service line, with the heart showing some of the key words, and I will put up the full vision at the end of the slides here. But again, you'll see healthiest lives, you'll see accessible, innovative, high-quality behavioral health service line. And so that's what we set out to do after we did our initial assessment. And this is, and thanks to, so I want to have a call out to Sarah Wise, is one of our directors of nursing that has left the state, unfortunately, and really was key in the leadership of this work. And this is her depiction of the vision of what we wanted our service line to look like. And this is a journey, so we're not there yet. You're gonna see some little yellow boxes there, which means we still haven't quite gotten there with even some of our services. And this will be a journey that will keep us moving forward as we move through. But you'll see that at the top, it's a behavioral health home with no wrong door. So for this community, that was what we felt was important. And we wanted to integrate those services, so as they needed the different steps of care, they could find that access, get in easily, get in a timely manner. And we did obviously expand some services as well. What we did start out with, though, is we felt we needed some help, some real expertise. And so by the support of our foundation, we were able to contract with Horizon Health, which is they're experts in behavioral health service line, to really help us look at our service line. Where were our gaps? What could we do? What did we need to look at? Did we have the right people in the right places, et cetera? And then we obviously engaged our internal experts to try to start looking at how do we create that vision? How do we get to that vision? And what is our journey going to look like? So here's a few of our projects. We went, the top one actually was one we felt was really important to begin with. As we were creating new services, we wanted to make sure we were going to get paid for that care. I will tell you, this has been one of the most frustrating, one of the most celebratory at times areas of this project has been looking at the revenue cycle. A lot of smart people, a lot of people who really want to get through all of the barriers that we have. And yet it has been 2 years, and I feel like at times we're still having the same conversations we had the first day we started that particular project. So we are working really hard. It isn't parity, so again, any of you that want to advocate more, as we heard earlier, they make it very challenging. Any payer makes it very challenging for us to get paid for behavioral health care. We looked at some workforce optimizations. Horizon Health gave us some ideas. We also built on that as well, used our internal experts as well. One of the things we continue to work on, we kind of got caught in the middle of this change at the state level to the Behavioral Health Administration. All the regulations changed about the time we were ready to put in our application. So we've been delayed a bit, so we're about double the time. We thought it would be starting this service in our inpatient unit last year at this time. It looks like it'll be this year at that time that we will move through that. And a lot, again, nobody's fault, just kind of the timing at the state level and us being able to meet the new regulatory rules. We looked a lot at our outpatient capacity. So that's not only in our counseling center, but also looking at it from the perspective of adding some more outpatient services. So we have added ketamine services, so ketamine infusion services. We've also TMS, so transmagnetic stimulation services as well. And we have now created what we are calling I'll see if I can get this right, the Center for Interventional Psychiatry. And so that's also where our ECT services are as well. And then we've had the help of Erin, who's here today. Erin has really helped us start advertising and start sharing these new services that we have, but also our current services, the services that we've had, and really being able to put those into a way in which, again, our community can access the care. So that has been very important to us. So this is, again, where we're at. It's changed a little bit, as you can see from the original vision. And actually, Angela is going to be talking to you a little bit more in detail about some of those services. But this is where we are on our journey. We are still continuing. Again, I want to thank all of our partners here. This is, again, something that we need help with. We can't do this on our own. We are certainly trying to transform and meet the community needs from a BCH perspective, but we need all of you to really do this. And again, I want to thank the staff who are here, who have really been the powerhouse behind making these changes. These aren't easy. They're in hard work. It's very hard work. And then we come along and say, hey, do you want to do something different? And they have really stepped up and really been engaged in trying to make these changes as we go forward. So I will put up our full vision and see if there are any questions.
Thank you. I was pleased to see that, and probably people in the audience from BCH could comment as well, but everybody's really working towards that model to integrate full therapy support within primary care. You get just a team approach with respect to primary care and that therapist and medication reconciliation and just having a plan, because once they leave that primary care office, then it's a hunt to even find somebody that has an opening for a therapist who's even in network. So I'm really proud to see if we can get more therapists embedded in all primary care locations, because that's the best model I've ever seen.
It is, and they do excellent work and really do support our primary care providers with this work. And so they have been key in this transformation as well.
Any other questions for Jackie? Thoughts about the transformation?